All right. This is April Fireside Chat with Eric Vickery of All Star Dental Academy and Dr. Michael Goldberg of Practice Perfect Systems. And we love just getting together every month. And we just been doing this for a long time. And we thought, you know what? Let's record it. Let's put it out there because we just have good conversations. Good mastermind, I think, is what it really is. And hopefully you're getting some just great value out of our discussion. So we were texting yesterday and thought, well, what should we talk about today? And you hit me with a couple 1-2 punches, and I said, yeah, let's do it. Let's jump in. So you have this course at the university that you're teaching. Tell us about it. And we'll start there.
So it's interesting. So in probably the mid to late 90s, the American Dental Association basically responded to the challenges that their membership were having in practice and decided that they would mandate a practice management course in dental school. Probably the wrong place to do it, but better than nothing, right?
Good intentions.
Yeah, no, great intentions.
Yeah.
And back then I was on faculty at Columbia University, and the dean knew that I had a successful practice, and he tapped me to run the course. I had actually been teaching business. I taught a CE course called Business Basics for Beginning Practitioners in, don't laugh,
I love it.
1984.
84. All right.
So I was only in practice 7 years, but I recognized the deficiency amongst all my colleagues. And I said, this is not good. We need to do something. And we did it through the CE. And then the ADA mandated it to be part of dental school curriculum. And anyway, I'm still doing that at Temple University. So second part of the course starts this week.
Okay.
On Wednesday. And this is all about financial hygiene.
That's the term, financial hygiene.
Financial hygiene. So the first part was sort of self-management, if you would. So my point in the first course was they're in the clinic now. They're already in practice. And they're probably picking up a bunch of bad habits.
Mm-hmm.
Because what they're taught in dental school probably doesn't translate that well to private practice.
Mm.
So you need to understand that.
Mm.
You need to understand that you're speaking to patients. The training that you have starts in dental school. Might as well. Most dentists, as you well know, are not extroverts. They're introverts. So they would rather work in the patient than on the patient.
Yeah. They forget there's a person attached to the tooth.
Well, it takes energy
Yeah.
for an introvert to converse with someone.
It's draining.
It takes energy. So anyway, this part of the course is you need to start having good financial management, financial hygiene now. I mean, these are kids coming out average of $350,000 plus in debt.
Yeah.
What are you doing about your credit? How are you? I mean, I think there's a staggering number. I think it's something like 75% of people who win the lottery
end up
go broke.
Yeah.
Why? Because these are people who never were taught financial hygiene.
They don't have the habits.
You mentioned the whole thing about 401ks.
Yeah.
And how many dentists are clueless as to the fees associated with some of the 401ks.
I've been working with our investor, and he works with dentists, and he just educating me on what's going on out there, where you'll get this 401k and rules will change without you even knowing. You'll sign off on something. They're not following their fiduciary responsibilities with you. They're not investing it the right way. You're paying a huge percentage for that investing. And there's this administrative fee, which, by the way, it's all public information. You can go on and look it up. He knows, he shows me, does a screen share, goes, look, here's your clients. And he shows me the fees that are being paid, tens of thousands of dollars a year, that's coming out of the doctor's 401k investment, not the team, some of the doctor's investment. So you don't get that, what you're looking for. That growth you're looking for, it's taking that exponential growth away, and you're paying something out of something you're just putting in. You're just paying, and you're losing. And so if it's asset based, that percentage, the more your 401k grows, the higher your fee you're paying every quarter. Don't do that. Reach out. We'll be happy to help you. We get nothing from it. It's just saving you money. So yeah.
I think one of my first lectures in the first course in practice management to the dental students is build your advisory board.
Oh, yes. Yes.
And build it now.
Mm-hmm.
So that, the worst time to go look for a resource is when you need it, because you wind up compromising on that resource.
You're in that's that Eisenhower square, when it comes super urgent and super important. It's like an emergency situation. It's not where you want to live. You want to be in the important, not urgent stage where you're planning ahead of time to get it done. Yeah.
So you probably heard this story. So I got caught like that because when I went to form a partnership with a couple of guys, my attorney had to recuse himself because there was a conflict of interest.
Oh.
And I was forced to find a new attorney.
Last minute.
And I went and I got great references, and I got, someone who knows the business, and they totally dropped the ball on protecting me in the contract. And the upshot was it wound up costing me $2 million.
Oh my gosh.
Fortunately, I'm a fairly astute businessman, and even that didn't totally
wow.
Yeah, it didn't kick me out of the game, but it was certainly a kick in the pants.
Wow.
And then afterwards, when I got my current attorney, he said, you can sue. I'm not I said, I'm not a fighter like that. So, you know what? Everything wound up being for the best. You and I probably wouldn't be having this conversation if I hadn't had that experience.
Yeah.
And, I don't know anybody, and I had this conversation with somebody this morning. I don't know anybody that's been successful that has not been knocked down.
Failure is a part of success. There's just no way to just the silver spoon in your mouth and go the whole way. It just doesn't work. You're not wired that way without failure. Your success is, you're standing on a pile of failure when you look at it, and you're still growing. You're still going to get hit with some failures.
And that's a common problem with dentists.
Yeah.
Because in the DISC personality profile, so many of them are S's and C's, and they want a plan before taking a step. They want ironclad assurances.
Perfect.
And a perfect GPS guide to where you want to go.
I can understand that. Yeah.
But it doesn't exist.
It's impossible.
You do your best, and you say, hey, listen, Elon Musk's Starship, whatever he called that rocket, that huge rocket, it lifted off the pad and then it blew up. Right? I don't know how many billions of dollars blew up.
My gosh.
Right?
Oh.
And he said it was a success. He claimed it as a success because it got off the pad, near the tower. They learned stuff from it. It's something like 16 engines, and like 3 of them didn't go, and it caused things to wobble.
Yeah.
They learned, But here's a guy. He's no longer the wealthiest guy in the world. Who is?
No, I thought it was the Amazon guy, and then it was the guy who owns the Chinese Amazon, and then who is it
So
now?
it's Bernard Arnault, who
Oh,
owns
Gucci and all that kind of stuff.
LVMH,
Yeah.
Louis Vuitton,
Yeah, I
Moet.
did see that. Yeah. What's his name again?
Bernard Arnault.
Or no. Yeah, that's right. I did see that. He owns all like the Gucci and the image and all that kind of stuff.
He
Yeah.
made his stock went up like $12 billion. His net worth went up $12 billion in one day.
And what was that from?
Stock.
But why did it all of a sudden go up? Who knows?
Because there was huge sales in China.
Yeah. Yeah.
And it goes to show, people have money
If they're spending it on that,
to pay for what they want.
Yeah, absolutely.
And they want luxury items.
They want to feel good. They
want the best champagne. They want the best handbags. They want the best shoes. Status is still status.
Mm-hmm.
And maybe even more so now in the TikTok generation.
Yeah.
Because they're promoting themselves.
Yeah.
So what are they wearing, right?
Yep.
I mean, think about it. It's very interesting. So I get a big kick when there are all the doomsayers that say that the economy is going to screw up dentistry.
Yeah.
And I'm like, well, how come LVMH is doing so well?
Yeah.
Right.
Yeah. Well, and that actually goes back to the insurance freedom conversation. We're doing the insurance freedom conversation so much these days because there's just as many people that shop at Walmart that shop at Nordstrom. Why are we trying to offer Nordstrom service quality at a Walmart price? Why are we trying to do that? And in the last 3 years since COVID, I don't think we've ever helped more offices change the relationship with the insurance, companies. So it is absolutely the truth that people are looking for that kind of support. Let me put it this way. They're looking for that kind of dentistry. They're looking for, how do I look good and feel good in life? And they understand they're going to pay for it.
So this is part of the financial hygiene conversation.
Mm-hmm.
Because if you ask most dentists what they make, they're going to say they're gross.
The practice.
Hopefully gross collections.
Mm-hmm. Yeah.
Hopefully they'll say that.
Mm-hmm.
But it's meaningless. If you ask them how much they took home, most dental practice owners can't tell you.
They won't know.
They won't know until they get their tax return.
Yeah. They're not paying attention that well. Yeah.
And then they'll know how much they made. How crazy is that? How crazy is that? I guarantee you, every employee knows
what they make.
Not only how much they make on their paycheck, but how much they make per hour.
Yeah.
You think a dentist knows how much they make?
That's so good. That's so good. That's where the trackers come into play. What's your production per hour? What's your production per patient by provider? Why does someone deter us from wanting to know that? Why, either the dentist or the team member? Why does the team member say, "Oh, we shouldn't be talking about money that way"? But wait, you just came in and asked for a raise. It doesn't make any sense. Or the doctor goes, "No, I just know that if I provide the best dentistry, the money's going to show up." I don't understand that mentality. I'm not after money and hungry and all kind of stuff, but I need to know how to manage my life. How do I know where I'm going? I'm just flowing.
So that's what we're trying to teach our students, because they're looking at jobs, they're looking at their debt, and they need to understand that when they graduate, maybe buying a Tesla Model S isn't the right thing to do.
The first year.
But that's what I'm going to reward.
I graduated. I'm buying myself something.
I'm going to reward myself.
Yeah.
I don't know.
Do you follow Dave Ramsey at all?
I do.
Oh my gosh. Live like no one else, so someday you can live like no one else. I love that saying. It's a little bit strict, I will admit. It's pretty strict. I don't
It's
know that I
very,
could do all of it. I've been through the course, done all the stuff, but I use a debt snowball tracker with clients that need it. We put all the debt in each column. We talk about what's paid off, and then that amount goes to the next amount, and you're doubling that payment. And we're just doing debt reduction and watching the percentage points drop on what you're paying in interest. It's exhausting. It's so expensive.
so, I don't know what you use as resources for your clients, but I work with a guy, Daniel Richards. His company is My Dental CFO,
Mm.
and he's a CFO,
Mm-hmm.
and it's his job to create. Usually, he tries to work with Dental Intelligence if he
Yeah.
can, to get a dashboard.
Yeah.
If not, he'll create one so that you can look at your financial dashboard, and on monthly meetings,
Mm. Every month.
discuss what's going on, discuss the numbers, the trends, and what you can possibly do about it.
Yeah.
But there are few dentists who either have the expertise or have the time to analyze all of these things. So this is a way to outsource what you need to know for someone who's an expert at it.
Mm.
If you look at the corporate structure of any big business, there's a CEO, and then there's a CFO, and then there's a
Yep.
COO, and then there's a CAO, and there's a CIO, and there's a CMO, right? There are a lot of O's. And dentists wear all 8 of those hats,
Mm.
and oftentimes not effectively.
Yeah.
So
So true.
with the hats, I'll tell you a little epiphany that I had the other day. So yesterday, I acted as moderator, interviewer at a fundraiser for the Dental Volunteers for Israel clinic that I help support in Israel. And our guest was a dentist who also became a comedy writer,
Oh yeah, I saw you emailing about this. Yeah.
stand-up comic.
Yeah.
I mean, the guy, can I share my screen?
Let's
Screen?
see. Let me see. Share your screen. Yes, you can share your screen.
All right, let's see if I can pull up. So this is Jeff. This is Jeffrey's the guy in the mustache here.
Okay.
And I don't know if.
So he writes for all those comics.
So he wrote for all these comics.
Wow.
All right. Especially, he started off with Milton Berle.
But he's a dentist.
He's a dentist and was always a practicing dentist. And
Wow.
here's him with,
Wow.
people we all know, right?
Yeah.
He's writing something now for Kevin Hart.
Wow.
Anyway, just so we had this great. I could have spoken with Jeffrey for hours. I'll send you the copy of the.
Yeah, that'd be great.
The webinar. So, but he tells a story about, he went to Temple University, which is where I now teach. And he tells a story about being beaten down in the clinic.
Yeah.
And it's not an uncommon story.
No, that's how we lose our confidence, right? Let me guess. Was it a wax up on an articulator, and the guy just went bang 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 on the occlusion and just crumbled your wax up that you spent 4 hours on? What, 2 days on? I hear that all the time.
So his wasn't. His was a redneck. He said a guy his professor, the chairman of the pros department, had in his office a Confederate flag in the back of his chair, and it said, "The South will rise again." Made him get a haircut. Wouldn't let him in clinic until he shaved his head.
Wow.
but he said something, he said a couple of things. He sort of melded his dental career with his comedy career and brought some of his own experiences in having to heal himself from the what he calls heart wounds that he sustained in dental school and elsewhere. He's a short guy. The only one that he was taller with then was Kevin Hart. I mean, Amy Poehler,
taller than him,
towered over him. So anyway, so he talked about how he got knocked down, and I'm saying to myself, wow, I wonder how that impacts dentists in their leadership roles down the road. It can't be healthy. And there's no course that I know of that cures people from that kind of negativity. So here you have people who are mostly introverts. They're S's and C's, so they're security and conscientious driven. And you've beaten them down so they have low self-esteem. How does somebody recuperate from all of that and become an excellent practice leader? So I know that you're a John Maxwell trained. I said, my friend Eric is going to have some good ideas about that. So
yeah, I love leadership, and so some things that are ringing through my head that I've learned over the last 25 years. Approval addiction is a real thing, and that comes from how we're beat up. And so what's our confidence level? And you can't come across as a leader. Let's just take from a patient's perspective, right? When you're hemming and hawing and doubting yourself or coming across as doubtful, they're not buying in, right? So what is the projection that you're giving? What's the confidence level that you're getting? And a lot of that stems from what's going on up here. Your most powerful tool is your mindset. So how are you talking to yourself right when the alarm goes off? Oh crap, I got to do this again. Or is it, it's like, I think both of it could be, oh God, but it's how do you, what's the tone of voice you use when you say, oh God, right? So like, all right, okay, God, all right, let's go. And the other one's, oh God, and so what are you saying internally to get you there in your self-talk? I use, from a leadership standpoint, I use an acronym called SHAPE. What shapes you? What is your shape? So we use Strength Finder. We use Habits, Atomic Habits by James Clear. We use appreciation languages, Gary Smalley's, right? Appreciation languages. We use personality profile, DISC, and we use emotional intelligence. So that's the SHAPE acronym that we use. And you don't know who you really are until you go through this and really digest and spend some time and figure out who you are in all this. While at the same time, you're working through approval addiction. So it's kind of a simulcast. It's these two tracks that you're on while you're doing it. And you start having to recognize what's going on. And there are things that we look at and say, uh-oh, there's a lot in your past that is too big for us as coaches to work on the future. So coaching is the future, therapy is the past. And so I will sometimes sidebar and say, hey, my wife, Abby, is a therapeutic coach. You get on Zoom with her. She'll work with you 2 to 4 times a week and get through this sort of stuff. And then I can start giving you the coaching hacks, the habits, the habits to work through this, whether it's self-talk, whether it's focusing on your strengths, understanding who you are and your strengths, and what challenges you have in strengths that hold you back. And there's no way a coaching hack's going to work if you're not healthy from the past.
And that's, and I think that was the epiphany. So I love, I mean, even as a dentist, I liked understanding causes before I tackled trying to treat a symptom.
There you go. Yeah.
Because if you didn't treat the cause and you treated the symptom's going to come back.
Yep.
Right. So the cause in a lack of leadership could be a whole host of things. And if you can't get to that, then you're not going to be able to coach people to go further. So I think that's brilliant. You're able to offer someone a therapeutic resolution to the past.
Yeah.
That allows you to coach them to in the present and towards the future.
Yes.
I think that's brilliant.
Yeah.
One of the I'm curious, so a lot of dentists, certainly my vintage dentists.
The classics. Is that what you're saying?
I like that. Have a little license plate. So a lot of us started practice on our own, or we bought at someone's practice, but we were practicing on our own, solo.
Yeah.
And, we built up organically as we became, successful, and patients started referring and yada, yada, typical trajectory of a solo practice. But I thought of something, and I think in that kind of practice, there's often the feeling amongst the doctor that the doctor is the smartest person in the room.
In everything they do.
Yes. And it's because, look, we're not hiring people of our same educational background. We're probably not hiring people of the same socioeconomic background. And there's this air of superiority that probably permeates all the conversations, maybe even conversations with patients.
Yes.
Because your conversation. It's hard to switch channels. Sometimes. So I think that's a huge issue.
So you're tapping into the emotional intelligence side of SHAPE, that acronym. That's a deep dive with dentists first, and then maybe the team. And in the book, they talk about the study they did with the top CEOs in the country, hundreds and hundreds of them. I think it's 500 that they studied. And only 20% of those top CEOs had high EQ, right? Sorry. Only 20% of them had high IQ and average EQ. So in other words, if you were really a brainiac, you get this high IQ, there's a 20% chance you're going to be a great CEO. But 70% of them had high emotional intelligence and average IQ. That meant, break down EQ then, Eric. It's they were able to relate to people. So there's two sections of two. So self-awareness, self-management. How self-aware am I and how I'm being, and how do I manage myself, especially emotionally and reactively? Okay. And then the other side is socially. Social awareness. Can I read the room when I walk in the room? And then relationship management, which is exactly what you're talking about. Everything we teach when it comes to leadership and case acceptance is about relationship management. Everything falls in that category. It's a heavy category. And so if you are a high C personality type, which means you're not people-oriented, or you're a high D, you're not people-oriented, you're going to struggle in that area typically. So then we look at Strength Finder and say, well, what are your top 5 strengths that we can tap into to say, let's manipulate that into being relationship management strength? How do we take that strength you have and say, okay, stop putting a round peg in a square hole. Let's take that round peg and put it in a round hole over here on the relationship side and make appreciation languages a task for you. Make it a check in the box. It's almost a manipulation of yourself. How do I manipulate myself to get good in this area so that I can be on their level? How do I interact with this team I have? If I have this different IQ than them, because I was a brainiac, I was undergrad in science, I have a different social economical status. How do I relate to people in that? Not only your team, but your patients too. You're leading that. So you really get the juices flowing when you start talking about leadership and relationship management. John Maxwell says leadership is influence, nothing more, nothing less. And I just tack onto that, you can't influence people that you're not in relationship with. So what's your relationship skill like? Make sense?
Yeah, no, it's really interesting. And, having been an employer and having, lots of dental personnel work for me, I realized that, and I'm a D.
Mm-hmm.
So I used to be an I. I used to be an ID,
Yeah.
and through circumstance, I morphed into a full-fledged straight-on D.
Life beat it out of you.
Well, no, it's circumstantial. So,
Yeah. Life experience.
when I was put in a position
Yep.
where I had to manage
Yep.
28 other prima donna professor dentists when I ran a faculty practice, I had to exert that part of my personality.
More. Yeah. The dominant
And
style.
yeah,
Yeah.
it
Makes sense. No, it makes sense. But let me ask you a question. Was it a positive thing for you to adapt to that? Because you have your natural behavior, adaptive behavior. And sometimes people can't stay in adaptive behavior very long. They got to go back to that natural style. So was it stressful for you to do that? Did it come natural?
No, it was very stressful.
Yeah.
So I think the theory is, if they used to give the D, the I, the SC like a number.
Yeah.
Instead of putting it on that circle.
Yeah.
I like the number.
I like the number, almost like a plot graph, up and down, up and down. Yes, I like that.
If your adaptive behavior was 25% higher or lower than your
Natural
behavior, that was a sort of a stress breaker.
Yeah, sign of stress and potential burnout. Yeah.
Yeah. So and yes, I mean, it definitely was an issue, and frankly, it was an issue I needed to go to therapy for.
Yeah. Yeah.
I needed, because I went right out of that into a partnership, and I exerted that D in ways that were not effective.
Yeah. Yeah. Because it's not on the relationship side. It's on the task driven, get it done. Let me tell you what to do side. Let me just going to direct you. 100% agree.
Right. So, and I'm totally results oriented.
Yeah.
So if I'm not getting the results and you're not doing what I think you should be doing, you're going to hear about it. And you're probably not going to hear about it in the most gentle and kind way.
Yes.
So so no, I don't like that.
Yeah.
It was stressful.
So let's bring it back to Maxwell. So 2 laws, law of the lid and law of the rubber band. The law of the rubber band says you can only be effective if you're being stretched. But stretch too much, what happens to a rubber band? Snap. Yes. You're going to hold things together, but it's that finding that perfect tension. And he basically says you're not growing until you get to that place of tension. There's no growth in you until you get to some tension. And I'm just saying, hey, be careful. It's not too much tension. Don't try to take on too much, which you're alluding to.
And what we find with most dentists is that they don't want to put any tension on.
Oh gosh, just let it go. Yeah.
Right.
So law of rubber band, I'll put this here in the notes, law of rubber band and law of the lid. You're probably familiar with that one. Law of the lid is this invisible ceiling that I place on myself. I'm just this way. And there's no adaption. There's got to be some adaption, but not too much. And it's finding that healthy balance in it to know, okay, or it could be self-belief lid you put on there, or it's just this fear, those 4 fears, right? Fear of loss of control, right? Fear of indifference, lack of love, fear of conflict, and fear of inaccuracy or making the wrong decision. If you go around the DISC, right? So D, fear of loss of control, manipulation. I, fear of being indifferent, somebody not loving me and appreciating me. S, fear of conflict. C, fear of inaccuracy or criticism for making the wrong decision. So if you go through these fears as this person, you can also place that lid on you and say, well, I'm not going to try that because I don't want to fail again. And go back to success only comes through some failures, right? Success is the formula: failure plus failure plus failure plus failure plus equals success, right?
So what's interesting is that in many circumstances, the lid is actually external. That you have your relationship with somebody. I mean, Jim Rohn said you are the average of the 5 people you hang around.
5 people you around. Yep.
So, and if you're with people who see you going beyond their little whatever, they're
gonna crabs in a bucket.
Yeah.
They pull you right back down. Pull you right back down.
Right back down. And it's hard, especially if you're a relationship person, if you're an I or an S, those relationships mean a lot, and it's really hard to get away from that.
Yeah. So true. Maxwell does a really good job in his 5 levels of leadership. There's the 21 irrefutable laws of leadership that we're talking about, law of the lid, that kind of stuff. But the 5 levels of leadership is, I have this, and this is right out of school for dentists to listen to this. So my position, level 1 is, I've been given a title. So I'm the dentist, therefore I am. Do what I say. Well, that doesn't get you very far. And you and I agree on this one, giving someone the title office manager. I mean, that was probably the biggest mistake my father-in-law gave me on day 1, no dental experience, 25 years old, walking to a dental practice and him calling me office manager. That just created resentment, right? And it's like, no, I'll never use that title again, because that position means nothing to the people who are supposedly following you. You haven't earned it.
No one likes to be managed.
Yeah, it doesn't get you somewhere. It does no benefit. So level 1 is position. Level 2 is permission. I finally have enough relationship with you where I give you permission to then be my leader, right? Oh, you hired me. So when that happened was, office manager, why are you talking to me? This guy over here hired me. I give him permission to lead me. Okay, so position 1, okay, I give you permission. 2, and then 3 is production. You show me how to be more productive in my life. I got a bonus. Oh, I like what we did there. Let's team up, right? You lead, I follow. Okay. Level 4 would be the ability, people development. I now am pouring into you. I'm teaching you how to be more productive. I'm teaching you how relationship management. I'm teaching you how to get places in life. So most dentists are going to lie in those first 4. 5 we don't worry about, which is legacy. It's the John Woodens and the John Maxwells and those types. But those 4 we're really focused in on and saying, okay, how do you navigate through that? So we have a manual type thing that you go through with the book, and you learn, and you say, okay, in my relationship management as a leader, here's where I'm stuck. Here's why I can't get to the next level because I haven't figured out how to achieve X. And you actually have to contemplate it. You really have to chew on it and figure out, well, what am I doing as a person when I relate to people to not allow that to happen? And if we figure it out, like you said, you have to diagnose first. Once we diagnose the problem, then we say, well, here's your strengths, here's your disc, here's how you are molded in your natural behavior. How do we use those to your advantage to get to the next level?
So what's interesting to me is I have not found books to be very effective in changing doctors' behaviors.
11% of implementation rate from a book.
11%.
Yeah.
And I think it's one of the real values of working, not to pat us both on the back, but it's one of the real values of working with a coach, because we all have blind spots, right? But more importantly than that, it's important to be given a model. And oftentimes the model needs to change based on one's particular circumstances. There's no one model for anything. So how do you do that? And the answer is it's very difficult for an individual oftentimes to do it. I didn't really appreciate that, and I was successful. And then when I got a coach, it was like rocket fuel. That was a huge deal. And it happened at the perfect time.
That study shows, this is from a big consulting group, and I can't remember their name, Star something. I can't think of what it is, but they're like a Gallup. They did a study and said, okay, if you want implementation in your life, you want to grow, what are the chances? 11% from reading a book, 25% from the visual and the audio, meaning I went to a seminar, 25% now chance of implementation. So all the things you hit, 1 out of 4 things you're going to put in play. And the only way to achieve 100% implementation is through mentorship or coaching. One-on-one implementation will happen through accountability. And it doesn't mean you're always with the same coach, just means you always have someone that you work through. I have probably 3 or 4 coaches that I am having access to, you being one of them, right? Just anybody that I can mastermind with and brainstorm is going to create something in me to get me fired up to say, okay, I'm gonna keep doing this, this, and this, right? Someone to create some accountability with me. If we don't schedule this every month at the end of when we talk, I don't have, it's gone, it disappears. But you create accountability and you say, all right, here's your homework. Here's what you're gonna do next time. What's the expectation? So that's why when I read a book, I only read 1 chapter or maybe 10 pages at the most at a time. I take notes on it. And then the very next day, I'm focused on who am I implementing this with? So right now I'm reading The Infinite Game, Simon Sinek. I know you like that one. Yeah. So I'm right in the middle of that. So it's just reading that and saying, okay, I'm just going to take that. I'm going to digest that for a day. I'm going to have it in my notes and I'm going to use it in my coaching calls the next day. I'm going to implement the next day. Because if I don't talk about it with someone, if I don't communicate my strength, it just disappears. So yeah, I completely agree with you. So, and then lastly, why coaching is so good is, what's that? It's a centuries old formula. Success equals intentionality plus mechanism. That's that formula. Intentionality could be determination, right? Your determination factor, I have all the gumption in the world, but plus mechanisms, I need systems to do it. So a coach can teach you how to become determined. They can give you some things, and mental toughness and your mindset, all that plays a role in it. But the systems are missing, you won't know how to do it. You could be as determined as all get out, but if you don't know how to, you won't get there. You just keep running into brick walls. Now, the person who has all the systems, they know all the information, all the knowledge, but they don't have any determination. So what? They won't get it done. It takes both put together to achieve the goal. So that's where coaching comes into play. And how do you create growth, and how do you constantly growing? There's a speaker at our church, and he said, I've often said, I think Tony Robbins says, if you're not growing, you're dying, it's growth or decline. And he says, I love the way he said it, and I got to formulate it, but he said, if you're not growing, you're coasting. And the only people who are coasting are going downhill. And I thought, okay, that's the same sort of formula, right? Same concept.
Or being pushed by the wind.
There you go. So what's the downhill slope for you is just not going uphill. If you don't have the uphill 1% growth every single day, if you don't have that mentality, nobody's following that. As leaders, nobody's jumping on the board with that. That's the people development side of you. That's the production side of you. So this has been a lot of fun. I like this topic.
Well, you're good at it, which is great. And I think it's hugely important. And it's what I see. Look, it's the reason that in the first course at the practice management course, we talk about self.
Yeah.
Self-awareness.
Yep.
Understanding how you think about yourself and how you present yourself outwards to the people that you work with. It works for your employees. It works with your patients. And that's the good news, is that that's in your control.
Yeah.
Very few things within your control, but you are within your control. So that's what you work on. And what we find as consultants going into practices is that's the biggest, that is the first hurdle, is somebody, and it could be the dentist. I have a client right now it's both the dentist and the office manager. So
It's leadership, the leadership team. Yeah. Do you like Traction by Wickman, the EOS system?
EOS. So I do, because it's a lot of the stuff. I mean, it's basically a distillation of, Jim Collins, Lencioni.
Yeah. Yep.
E-Myth.
E-Myth.
Yeah, it's all that stuff
Yeah.
into a
Condensed,
as a
like
matter of fact,
one.
as a
Yeah.
matter of fact, I had a conversation with them last week, because I was saying, should I become an EOS implementer? I understand all this stuff, and you know what? I make more money than they do. So
Yeah. Yeah. They have almost like mentors or advisors or something. Yeah. You need a coach who can wrap their brain around it. We have people on our team that are better at it than I am, as far as coaches go, but it gives you structure. If you have your vision, structure, and then what are your team meetings like? Do you have effective team meetings? You know how to implement, you know how to create accountability, and that's an internal coaching system that you're creating, because you're being an entrepreneur. So yeah, we could keep going on and on with all the systems that are out there, but yeah. All right. Well, this has been fun. I hope people are getting a lot out of this. Some of you that are listening, we'll see at our May event in Florida for our Growth Summit. We will be doing a All-Star Mastery Level 1 in October in Maine. So we will be up there teaching a 2-day course on case acceptance. So if you're in the Northeast and you want to join us the third week, I think it's the 19th and 20th, so Thursday and Friday, we'll be up there. Just reach out to me and let me know. What do you got on the docket?
So when you're going to be in Florida, I'm going to be in Philadelphia at the American Academy of Dental Sleep Medicine meeting, and Spencer Study Club Live, and I'm giving a talk on From Hello to Hugs.
I love it.
And then in November, we'll go back to Glidewell and give a course there as well. When there, I'm going to have a big, I think, team workshop.
Nice. Okay. Yeah. A lot of fun. So there's plenty of support out there for you. If you need anything from therapeutic coaching to leadership coaching to financial flossing, all of it's there for you.
Financial flossing.
I love it. So good. All right, you guys have a great April. Take care.